Trichomonas infection, also known as trichomoniasis, is a sexually transmitted infection (STI) caused by the parasite Trichomonas vaginalis. It is one of the most common curable STIs worldwide, though many infected individuals may not show symptoms. Trichomoniasis can affect both men and women, though it is more likely to cause symptoms in women. Causes and transmission: trichomoniasis is primarily spread through sexual contact. The parasite Trichomonas vaginalis lives in the urogenital tract, the vagina in women, and the urethra and prostate in men. It is transmitted through vaginal, oral, or anal sex with an infected person. Non-sexual transmission is extremely rare because the parasite cannot survive long outside the human body. Symptoms of trichomoniasis: symptoms usually appear within 5 to 28 days after infection, but they can also appear much later. About 70% of infected people may not experience any symptoms. When symptoms do occur, they can include: in women, vaginal discharge, often frothy, yellow-green, and may have a foul odor. Itching and irritation, itching, redness, and irritation in and around the vaginal area. Painful urination, a burning sensation during urination. Discomfort during intercourse, painful or uncomfortable sex. In men, discharge, unusual discharge from the penis. Irritation, irritation or itching inside the penis. Painful urination, a burning sensation during urination. Prostatitis, in some cases, the infection can lead to inflammation of the prostate. Complications of trichomoniasis: if untreated, trichomoniasis can lead to more severe health issues, particularly in women. Complications can include: increased susceptibility to other STIs. Trichomoniasis can make individuals more susceptible to contracting other STIs, including HIV, due to inflammation and breaks in the genital mucosa. Pregnancy complications: when pregnant women, trichomoniasis can lead to premature birth, low birth weight, or transmission of the infection to the baby. Pelvic inflammatory disease (PID). Although rare, untreated trichomoniasis may lead to PID in women, which can affect fertility. Diagnosis: healthcare provider can diagnose trichomoniasis with the following methods. Physical examination: in women, a pelvic exam may reveal signs of inflammation. Microscopic examination: the sample of vaginal or urethral discharge can be examined under a microscope to look for Trichomonas vaginalis. Lab tests: more sensitive tests, such as antigen tests or nucleic acid amplification tests (NAAT), can accurately detect the parasite. Treatment of trichomoniasis: trichomoniasis is treatable with antibiotics. The most commonly prescribed antibiotics are metronidazole. This antibiotic is taken either as a single high dose or in a longer, lower dose regimen. Tinidazole. This is an alternative to metronidazole and can also be taken as a single high dose. It's essential to complete the entire course of antibiotics, even if symptoms improve. Sexual partners of infected individuals should also be treated to prevent reinfection and further transmission. Prevention of trichomoniasis: reducing the risk of trichomoniasis involves practicing safe sexual behaviors, such as consistent use of condoms. Condoms reduce the risk of transmission, though they do not completely eliminate it. Limiting sexual partners: reducing the number of sexual partners and avoiding unprotected sex with new or multiple partners. Regular STI testing: regular screening helps detect and treat infections early. Avoiding sexual contact when infected. Abstain from sex until treatment is complete and symptoms have resolved. Outlook and follow-up after treatment: most people recover fully from trichomoniasis. Retesting may be recommended 3 months after treatment, especially for women, as reinfection rates can be high. Continued follow-up with a healthcare provider can help ensure that the infection is fully cleared and that any potential complications are monitored. Conclusion: trichomoniasis is a common but curable STI. Timely diagnosis and treatment are crucial for preventing complications and reducing transmission. Practicing safe sex and regular screening can help manage and prevent trichomoniasis effectively.